Good day, grade 10. Today is our MAPEH 10 Health in the fourth quarter, week 1. My name is Reynaldo B. Malimban. In our lesson, let's talk about our objectives of consumer health. First one is assist consumers in choosing better health products and services. Second, provide information regarding the health products that consumers wish to buy and the health services they wish to avail of. Health consumers recognize reliable sources of health informations and also in guide consumers in buying health products and services. Now, let's talk about the consumer health. This health information through health education, health departments helps people and communicates. The school learn basic health information. Public health involves teaching people to understand and the importance of environmental personal health measures. Pamphlets, films, seminars, TV, and radio may be used to convey health messages. The health educators to encourage people to use these informations by making posters and pamphlets available to the public. Now, let's talk about the personal health records. In the health products are those substances, material, or equipment prepared for the manufactured for you to buy in use in maintenance of health and the treatment of diseases. Example, the foods, eyeglasses, medicines, cosmetics, cars, appliances, and others. Now, this personal health record is a document of information about the health and the health of the family members that you keep up to date for every reference. So the informations being included the date of the children, immunizations, last physical examination, major illness and operations, allergies, list of family medicine, treatments, and tests and medications. So that is part of personal health record. Now let's move on for the NER or electronic health record. In the electronic health record is a computer-based from the document that used by your doctor or medical staff and that contains your health informations. Some of ENRs have medical alerts to remind you to your doctor to perform certain tests or procedures. So these are the removing of the electronic health record based from the research from physicians to clinicians, hospitals, radiology reports, vital signs, insurers, and the laboratory data. So what are the EHRs? So this electronic health record is the longitudinal electronic record of the patient health information generated by one more encounters in any care delivery settings. In the electronic medical record or EMR contains information from the single organizations. The electronic health record or ER records that span the organization. So it is a way for the doctors, other health care providers to send your prescriptions to your pharmacy or the electronically instead of the writing of prescriptions and having you take into your prescription. Your doctor orders medications through his office computer, which sends for the prescription to your pharmacist. Let's move on for the electronic prescribing or its benefits to healthcare or IT industry. In involving healthcare through information technology, it using health information technology to manage your personal health is an important part of the changing healthcare system. Using computer and other electronic devices make it easy for you. So your doctor is other healthcare provider to store, share, and access to health information. So kids, this is all about the health information technology may be useful. For example, reducing paperwork for eliminating the handwritten medical records. Another, reducing medical errors for transmitting accurate informations, or the electronically and eliminating mistakes due to misreading for your doctor handwriting. And also the reducing healthcare by decreasing the use for medical tent. So these are some involving healthcare through information technology. So what is this information technology or IT? This is the exploring the cutting edge of the healthcare system. So there are some advantages of hospital information systems. One is the increased time nurses spend with the access of informations, and to improve quality of documentations, to improve quality or the patient care, and also the increase during the nursing productivity. To improve the communication, reduce the medications errors. We also to reduce the hospital cost, increase nurse job satisfactions, development in common clinical database, improve patient perceptions of care, and to the enhance ability to track patient records. Enhance also ability to recruit and retain staff, and to improve the hospital image. So that is how the advantages of hospital information system. In healthcare, there are three main goals. One is prevent health problems, maintain good health, and treats problem. Now, how to choose your own health services? In choosing health services, we also these types of health care. So this is the wide range of professionals and practitioners who are part of the healthcare provider. Nurse, dentists, and doctors who are work in hospital or clinics are, as well as the health teachers, are part of the healthcare system too. So the healthcare has three main goals, as I said a while ago: to prevent, to maintain, to treat the problem that arise. So healthcare services can be given in places like clinics or hospitals. The place of treatment can be classified as inpatient care, example treatment in hospital or clinic. Outpatient care, someone who comes to healthcare unit to be treated and lives on in all the same day as an outpatient. So some facilities provide services for a wide range of health problems. A hospital provides a wider range of services. A nursing home gives health care to older people. So the outpatient care, the patient receives treatment and then returns to the home, while the inpatient care, that stay on the hospital on other healthcare facility. Let's talk about a family doctor. A family doctor provides basic health care to the people. A specialist are trained to handle particular kind of patients of health matter. Private practitioners have their own offices or clinics. In the health insurance, it is a program in which a person pays yearly fee to a company that agree to pay certain health care costs. For example, here in the Philippines, we have the PhilHealth. According to the Republic Act 78 to 75, National Health Insurance Act of 1995, and established the Philippine Health Insurance Corporation or PHIC, and more commonly known as PhilHealth. So PhilHealth is all employed sectors program, compulsory to the coverage of the government and the private employees. Individually paying programs like voluntary coverage or self-employed or others, and also sponsor program to cover the poorest of the poor, and also the Overseas Filipino Worker OFW, a lifetime member of program, this PhilHealth more than 60 years old and above who are complete 120 monthly contributions before. So a senior citizen also automatically covered since on 2015, and this is example of my health ID. Next, let's move on another view about the health products for you. So in the health products may be classified into what? The medicine and physical health product, example antibiotic, dietary supplement, example vitamins and mineral, grooming and personality used to beautify one's appearance, example of soap and shampoo. In medicine is a term of applied to any drug that used to treat, diagnose, and prevent disease and relieve pain of discomfort. A drug classified according to its purpose, like diagnose and prevent disease, example of antitoxin and vaccine. Treatment of disease, example of antibiotic. Relief to discomfort or pain, example of analgesic. In the dietary supplement is any substance such as vitamins, mineral, herbal products, or other ingestible preparation that is added to the diet to benefit health. In the United States, dietary supplements are defined as products intended to the supplement of diet that contains at least one of the following ingredients. In vitamins, mineral, herbs, extract of herbs, amino acids, metabolite multivitamins, garlic tablets, fish oil capsules, probiotic, 8 natural weight loss, fiber or fat burner, and different types of energy drink. In the dietary supplement must be labeled or must be intended for oral administration or tablets, capsules, powder, and liquid form. Now let's move on for another set of the complementary alternative medicine. This complementary and alternative medicine involves any various approaches intended to improve or to maintain human health that are not part of the standard medical care or conventional or Western medical system. The various approaches of CAM or complementary and alternative medicine typically are used in manner, and that is complementary to standard medical practices. Such as approaches are sometimes referred to the holistic or traditional medicine. This includes classical systems such as the Ayurvedic medicine, traditional Chinese medicine, which are centered to bringing together the mind, body, and spirit, and chiropractic medicine, biofeedback, art therapy, hypnosis, and also the prayer, special diets, and the torts. So this definition of alternative medicine is the health of balanced body system, physical, emotional, and spiritual environment, involving the whole patient's approach to the holistic. While the complementary medicine is alternative medicine is a group of diverse medical and healthcare system practices products that are not generally considered part of the conventional medicine. So many of these practices are considered be marginal when compared with the conventional practices. That is, they usually are not central part of medical medicine. However, partly because of growing evidence based on the supports that safety and efficacy of certain CAM approaches, some of practitioners of conventional medicine have also become the practitioners of CAM. So these are the completely complementary alternative medicine categories. In the alternative medical system, mind-body intervention, biologically based on therapies, manipulated body-based methods, and also the energy therapies. In the comprehensive health services, we have the hospitalizations, various therapy services such as physical therapy and devices, prescription drugs, laboratory services, mental health and substance abuse services, pediatric services, maternity newborn care, preventive wellness services, outpatients, ambulatory services, and also the emergency services. So these are some of the complementary alternative medicines. Okay, thank you for some of the reading of complementary and alternative medicine. Now, let's move on to the levels of healthcare, from primary level healthcare, secondary level healthcare, and tertiary level healthcare. So some countries like Philippines follow system or plan delivering health services to define populations. The one is the primary health care. Is the first level of health services provided by the health personnel and community health centers who are prevented, promote, and educate people in the community. Is a manage of ongoing health problems. While the secondary level health care is this level, more complex problems are taken care mostly when requires secondary level of preventive services and curative service, and these services are provided by the district health centers or hospitals, and those cases which cannot be handled at PHC or CHC are referred to the district health center. So this care is given to the patient referred from the primary care. And also the tertiary level health care. So this level of health care is provided at the state, regional, central level institutions. So these institutions serve as referral units for primary and secondary levels. This also serve the teaching institutions by education, training of the various categories of healthcare professionals. This promoted by the major medical center like hospitals and clinics. Let us move on another complementary from alternative healthcare services. There are some of alternative healthcare services like for example, the acupuncture, cancer treatment, cardiac rehabilitations, chiropractic care, cosmetic services, dermatology, nose and hair removal more, and foot care, genetic testing, and hearing exam or the hearing aids. This alternative system of health include the various healing approaches that originate from around the world and that are not based on the conventional Western medicine. There are some therapies are called alternative system of health, and they are used alone. In complementary medicine, they are used with the conventional medicine. Next, for the last show, this quackery is often linked to the health truth where there is no promotion for the profit of medical remedy known be false or unproven. This quack is an individual who pretends have medical skills but in fact has not, who sells worthless product and treatments for the disease and other health problems. quackery is the dishonest actions of a quack. Quacks are most often found selling products or services aimed at losing weight, improving people's appearance, or curing deadly or painful diseases. Now, let's move on for the consumer's welfare and protection. By the laws of protect this consumer's welfare, there are 8 basic consumer rights. So this consumer is a person who are purchase a goods and services to satisfy his or her needs or wants. Health services are those provided by the health practitioners like physicians, nurses, therapists, and other health works. Consumer health protection refers to the act of safeguarding the buying public for the fraudulent, misleading, and inferior goods and services. So what is the law of the Philippines that protects you as a consumer? The law of safeguards and protects that consumers in the Philippines is the Republic Act 7394 or RA 7394. And these are some of consumer rights or the basic rights of consumer. These are basic rights of the consumers are right to basic needs, right to safety, right to information, right to choose, right to representation, right to redress, right to consumer education, and the right healthy environment. So to selecting the buying health product, there are some tips in selecting buying health products. Take note, health products can be branded or generic. Branded products are more expensive than generic form. Read the labels of products, note to ingredients, effect, and direction on how to use this product. And you have to also to compare the cost and to the health products. Check expiry date and check also the packaging. Product should be the property sold. Again, let us try to review. This health record is document about your health and the health of the family member that you keep up to date for the reference. Before I leave this lesson, I give you some reminders that this part of our consumer health is we can give the main goals to prevent, to maintain, and to treat problems that arise. That's all for today. In your module, please answer the following activity. For more updates, please monitor our e-class online learning platform. This is Rinaldo Malimban. Thank you and goodbye.